So here at the ESMO meeting, we've had a superb data set presented by colleagues from China in the Guangzhou area, where colleagues had screened a mass population starting from the age of 40, 11,000 residents, compared to population controls with a single one-off CT screen to see whether it picked up lung cancer early. Well, what do they find? They found that compared to the screen population of 11,000 patients, picked up a huge number, in excess of 80% of patients with stage 0 to 1 lung cancer, with a big reduction in the numbers of stage 4 patients identified from a presumed distribution of the screening non-screen population. We haven't got details on the non-screen population, so that would be useful to get. We need to get further details from the stage 0 to 1, as well as to how many were stage 1 and how many were stage 0. They beautifully demonstrated with a one-off single CT screen that the rate of new lung cancer identified for about 4.5 years is reduced with a simple one-off screen, which is not quite what we've seen with other studies, and that one-off screen does improve survival markedly. The key issue is in CT screening whether survival is an appropriate metric, because there are a number of biases that contribute to survival, and really mortality benefit is the better outcome to show the efficacy of screening. The biases that we have include lead time, length time, overdiagnosis bias, and interval cancers. Finally, in the screening study, they looked at a multivariable model to identify those most likely to benefit from screening, and that looks very effective, but does need to have independent verification, ideally in other places. And they demonstrated that screening was cost effective, but we do need to see details of that screening cost effectiveness model to see whether that would work in other centres and other regions or not. Overall, a very exciting study. It does show that screening can be done in China, can be done without risk stratification. We need a few more details to better evaluate that properly.